Welcome to Raaonline. Today I will be speaking about imaging in spine. So my agenda of talk today is related to MRI. So mainly I will be covering regarding thoracic and lumbosacral region. Cervical I had mentioned in the last class, and main module which I will be covering in the spine is degenerative, tumor, infection and inflammatory. And mostly I will be covering the MRI, basics of MRI in all these modules. So whenever MRI is being ordered, so that's the gold standard investigation of any spine pathology. So you need to know what are all basic sequences available in MRI. So you know there is something called as T1, you know something called as T2. What many of them don't know is stir images, that is nothing but short tau inversion recovery sequence. It is a fat suppression sequence. Then there is something called as myelography, which is non-invasive modality, and there is also invasive modality, but the non-invasive part is T2 thin weighted images. Whenever you are dealing with neoplasms, you need to order for contrast scans, which is T1 based, and additional fat suppression sequences which is gaining popularity is the Dixon in and out phase technique. You have gradient echo sequence, you have prone MRI, and also you nowadays what we are started to do in spine is the DWI sequences as well as the DTI sequences. I will be covering each sequence followed by the modules. So what are the basic of T1 weighted image? So you know T1 weighted image, now I will just orient you the spine anatomy related to T1 weighted images. Now you see what is this is the vertebral body. Okay, this is a disc, this is a disc, okay, and this is the cord, and this is the subcutaneous fat. These are the posterior elements, nothing but the spinous process and the laminophysetes. And what you see is the ligaments here. So this is the normal thing which we see in T1. Now what are the characteristics that this image is T1? Now you can see the disc, whatever is fluid, it is dark in T1. So disc usually contains water, the nucleus pulposus. So that is that on T1 it is black, whereas the marrow, the vertebral body contains marrow, which is always brighter. Okay, so it is not that brighter, but it contains hemopoietic, elements. So that's why it is brighter than the disc. Disc contains only fluid, nucleus pulposus. So that is important. So this equation that the body is more brighter than the disc, this is the equation which should be noted in T1 weighted. What if this reverses? Then you can identify pathologies on T1 weighted images. Now, so T1 is an excellent anatomical, anatomical scan where you can see all the anatomy very clearly. It is a lesser time to acquire. Why? Because the repetition time as well as the echo time is shorter for T1 weighted images. What are the pathologies which can brighten up on T1 is nothing but fat related. You have melanin which can be bright on T1, the methemoglobin, products of hemoglobin, or the contrast agents which we give to brighten up the neoplasms or the infectious area. So those are all T1, T1 that can brighten up on T1. So contrast is basically used only in T1 weighted image. There is no T2 contrast, remember that. Okay, and one thing is the fracture lines is very excellent. I told you this is an anatomical scan, so any kind of fracture in the vertebral body can be easily seen in T1 weighted image. So this is the basic characteristic of a T1 weighted image. Now this is a T2 weighted image. Okay, so you can see that this is CSF. Okay, this is the cord, this is the caudal roots or cauda equina, what you call as, this is the vertebral body, and this is the disc. Now you can see the content, water content in the disc, that is responsible for the brightness of the disc in T2. Whereas T2, you can see that the disc is much brighter than the body. So this equation is always maintained in a normal thing. But as you degenerate, there is a normal process that the water content of the disc reduces. So disc also appears very hypointense as compared to body as you age up. So it's a normal degenerative process. As you age up, the nucleus pulposus reduces its water capacity, and that's how it appears slightly darker as you age. Okay, normally, but there should be nucleus pulposus should be brighter than the disc. And what is seen in the front is nothing but the annulus fibrosus, which is dark. That is just the fibers, annular fibers surrounding the nucleus pulposus. And the rest of the fat is, remember, fat is a substance which is bright on T1 as well as T2. So that's very important. It brighten up in T1 as well as T2. Both fat gets brighter up, but fluid only in T1. Fluid is classical and fluid is only in T1. As you see, the CSF is white, as well as the nucleus pulposus contains water, that is also white. T2 weighted images takes longer time. It has a longer echo recovery, as well as you have increased repetitions, that is also longer. So that's why it takes longer time to acquire. So any kind of fluid, any kind of edema, any kind of tumor or cyst, all they will brighten up on T2 weighted images. So these are the basic characteristic of T2 weighted image. So remember, vertebral body is relatively dark as compared to disc. This equation should be maintained in T2 weighted images, but there are some exclusions, like as you degenerate, the disc reduces in water capacity and it becomes hypointense.